Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Hi, everyone. Welcome back to The Cancering Show. As I'm recording this, we're still hoping to hit a number below 70 in the mornings tomorrow, fingers crossed. But we all know that fall and all of the cold and flu season is right around the corner. Whenever it's time for football, it's time to think about heading indoors, but also how to avoid all of the colds and flus that kids get at school, that we all catch from them, that grandparents catch from grandchildren, etc. And we can't have this conversation without talking about how to avoid these illnesses while cancering. I do feel like we have all had a master class in avoiding viral illness that was called the COVID pandemic, but it's been a while. And you might have noticed this summer that COVID is still around and there are still people being diagnosed. So we need to talk about it. We need to talk about how to avoid COVID, flu, other viral illnesses, and how to stay healthy. And this is true both for people who are actively cancering and for people in survivorship. For those of you in survivorship, you might have noticed your immune system is a little bit lower than it used to be, and it might take some time to build that back up. So let's talk about it. So number one rule to avoid any type of illness is to wash your hands regularly. So that includes, obviously, the soap and water. You'll remember we were all taught to sing happy birthday while you wash your hands. If you're using soap and water, to make sure that you get it completely and you're using an antibacterial soap and that you use it for that full 20-second duration. If you're using hand sanitizer, again, you want to make sure that it is up to date. It's not the bottle that you ordered during COVID, which is now over 4 years ago. So we really do want to make sure that we have a hand sanitizer within the last year so it maintains that efficacy for all bacteria and viruses. And you want to use that anytime you've been touching a lot of public surfaces, after you've shaken hands with someone or lots of people, and when you come home, before you eat, those kinds of things. So always keeping in mind to wash your hands. Next, we're going to talk about avoiding people who are sick. This seems very obvious. And yet I will tell you, this episode is inspired by a patient of mine who, while on her cancer treatment, went to a grandchild's birthday party, knew multiple children there were ill, and stayed anyway. And unfortunately, ended up in the hospital. So I want to encourage all of you, and if you know someone is ill and you are on active cancer treatment, it is okay to decline that invitation, to not come over to their house, to not let them into your house, to not show up at a dinner or an event where you would all be hanging out together. And if you do need to do so, to make sure that you are masked or that person is masked or both. So if there's an opportunity that you would be exposed to lots of people's germs, then we do recommend that you mask. So those types of episodes include when you are needing to fly on a plane, if you have to go to an event while on your cancer treatment, particularly if you're in that part of your cancer journey or cancer cycle where you know your counts might be low, pay attention when you get your chemotherapy teaching. And at the time, they will tell you when during the chemotherapy cycle your counts are expected to be lower than normal and when you should avoid large crowds. So keep that in mind on your calendar and think about either wearing a mask or avoiding large crowds during those times. Let's talk briefly about what mask you should wear. So for the average, what I would consider to be a low risk exposure, meaning you are going to party where you believe everybody is well, but it might be at a time when your counts are low. then you can wear a regular medical mask. So knowing what we know now, after all the research that was done during the COVID pandemic, we do recommend the medical mask as the most effective, more effective than any type of cloth mask or neck wrap that you would then pull up over your face. And so if that is the best option for you, that is the one that we recommend that you wear. Now, there are times when I would recommend to you to wear an N95 mask. The first time is if someone close to you, for example, your caregiver, is known to be ill, they would wear the N95 mask, the mask that prevents any viral particles from escaping to avoid making you ill. Next, if you are riding in a plane, particularly during your chemotherapy cycle, I would recommend to anybody who is actively cancering to wear that N95 mask. Now, if you are done with your cancer journey, but maybe worried that your immune system is low, or maybe you're, developing a little bit of mild cough or cold symptoms yourself, then a medical mask should be effective. Anytime you develop those symptoms, we do encourage you to take a COVID test first. COVID test or even a flu home kit is a very effective way to, number one, make sure you're not spreading infection, but also both COVID and flu have medications that you can take orally to decrease the chance that you would be hospitalized. So taking those home tests, calling your doctor, you do not need to go to a doctor for those tests, and nobody wants you in their waiting room if you test positive. So taking those tests at home, calling your doctor, and having them prescribe those preventative medications, it doesn't prevent you from getting the illness, but it does decrease the chance that you would be hospitalized for COVID or flu. Now, if someone very close to you has been diagnosed with COVID or flu, you would call for a prescription to get the exact same medications to take as prevention. Again, depending on the timing between your exposure and when you start taking the medications, it may decrease the chance that you ever test positive, but more importantly, decreases the chance that you would be hospitalized with one of those two illnesses. Now, the good news is if you test negative for both of those, it's probably just a cold. But all of those viral illnesses, viral respiratory illnesses, can become more serious infections and are more likely to become more serious infections for patients who are actively cancering on any type of cancer treatment or chemotherapy treatment, and for those who are recently finished with their cancer or chemotherapy treatments. And so when we tell you to take care of yourself, it also means watching out for symptoms of a more serious infection. So when we say take care of yourself, we mean drink lots of fluid, get plenty of rest, and do make sure that you're eating something. We want you to get in some calories to make sure that you don't get too dehydrated or too low on the energy scale that you are not able to get up and do the things that you want to do. Now, after you've taken care of those things, if you have a fever over 101, particularly any fever over 102.5, you would want to call your doctor. But if it's over 101 for more than 3 days, you would also call the doctor. If you are coughing up a very thick liquid or having just a racking cough, you would want to call your doctor for that, because that can be a sign of superimposed pneumonia. And if you have really bad sinus pain, face pain, forehead pain, ear pain, that can be a sign of a superimposed sinus infection. Now, most sinus infections are viral, but there can be an occasional bacterial infection. Last but not least, if you have any symptoms lasting longer than 10 days, definitely longer than 2 weeks, it is time to see the doctor, because there can be superimposed walking pneumonia, bacterial bronchitis, and sometimes just what we call reactive airways that require treatment with an inhaler. So for all of those reasons, we definitely still want you to get in to be evaluated for a viral illness. But we started this conversation talking about prevention. So what about that other stuff that we talked about when COVID was around? What about things like taking vitamin D? First, I would say, yes, do take vitamin D. It can improve your response to your cancer treatment, as well as decrease the chance of getting a viral illness. We know that having a normal vitamin D level lowers your cancer risk for lots of different cancers and decreases the chance of a viral illness. What about zinc? There are readily available products that have zinc in them that are advertised to decrease the length of a cold or to decrease the chance of a cold. And yes, you can take zinc supplements and they help with healing and viral immunity, but they can make people nauseated. So proceed with caution and make sure that you know what it is you're taking and what else is in it. Because here comes the third thing. What about high-dose vitamin C? So a lot of those anti-cold, airborne illness, etc., those cold prevention or viral prevention medications include high doses of vitamin C. Can you take that while you're on your cancer treatment? Actually, no. We don't recommend that you take high doses of vitamin C on your cancer treatment. It is an antioxidant, and many of our cancer medications work by creating high oxygen species that kill cancer cells. And any high dose of antioxidant in your system can actually give the cancer cells an advantage when your normal cells would have the ability to overcome it, but your cancer cells should die from those oxygenating species. So we don't want you to take extra vitamin C while you're actively on chemotherapy or radiation treatment. That being said, for those of you who have completed your treatment but feel like maybe your immune system is not as strong as it should be, it is okay to take that high-dose vitamin C as well as a prevention from the viral illnesses that will be around this season. So I do get asked, does chicken soup really have any healing properties? And interestingly, the answer is yes. So we know that the chicken, when it is cooked in the soup, actually releases an amino acid called cysteine that thins the mucus in the lungs and can decrease the symptoms of a respiratory infection. We know the protein in the chicken is always good for you. And also, there is a release of the vitamin B3, also known as niacin, which helps with nervous system, digestive system, and the uploading of other vitamins and minerals. So yes, chicken soup, when you're sick, can be healing for you. And of course, homemade is always encouraged. So I hope this helps you to stay healthy and happy over the fall and winter season, avoiding those viral illnesses. Remember, the number one rule is avoid people you know are sick. It seems simple, but always able to say, no thanks, I'll try you again next week. So until then, we'll be back next time with a brand new episode of The Cancering Show. Until then, keep cancering and take care of yourselves. Thanks again for listening. And don't forget to submit your questions at www.cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.